Hello again. Thanks for returning. I've got a cool story for you today about physical pain and emotional problems. And if you have ever struggled with physical pain or dizziness or fatigue that the doctor can't diagnose, then you're going to love this story. Okay, when I was a medical student at Stanford, I was kind of a screw up. I didn't want to be in medical school, and I cut a lot of my classes. But eventually I found my way as a psychiatrist, and I love the career I have now and a chance to talk to you and teach you some of the things I've learned along the way. And the one professor I just loved at Stanford was Dr. Barbour, and he was the head of the outpatient medical clinic at Stanford Medical Center. He had what we call the thick chart patients, and that's people came to Stanford from all over the Western United States when no other doctors couldn't help them with dizziness, with headaches, with back pain, belly pain, fatigue, and often the problem was not of a medical nature, but of a psychological or interpersonal problem that the patient was not attending to. And they brought thick charts because most of them had had multiple medical evaluations and medical, brain scans and heart scans and, all kinds of stuff costing hundreds of thousands of dollars. And I was really looking forward to going over to his clinic one day, and I had a half-day rotation there, and she said that Dr. Barbour said that I was going to see a woman from Alaska who was flying in from Alaska with her husband, who had a problem with belly pain. After an hour or so, this ambulance pulled up to the medical clinic. I guess they'd flown in on a private plane to the airport, and then an ambulance met them and drove them to the medical clinic. And she was on a gurney, and she was screaming and saying that she needed emergency surgery on her belly, a laparotomy, and that she couldn't stand the pain. And I was puzzled. Why then, if she needs emergency surgery, are they bringing her to the outpatient medical clinic? It made no sense. They should have brought her to the emergency room so she could be rushed into emergency surgery. But at any rate, Dr. Barbour said to go ahead and, check her chart, do a history and physical, and see what you think. So I brought her into the examination room with her husband. They started doing a quick physical exam and taking a history at the same time. And when I came to examine her belly, it was soft, and I listened for her bowel sounds, and they were normal. And that surprised me, because if someone has like a ruptured appendix or some peritoneal rupture or something like that, the stomach tightens up like a board, and then the bowel sounds stop. But her belly seemed totally normal. And so I said, would you mind just give me a minute to look through your chart here and see what other doctors have done. And I saw that she had had 7 emergency surgeries on her abdomen. And I read the surgical notes, and like they would go in and take out a lymph node, maybe thinking she had a cancerous lymph node or some such thing. They were looking for some abnormality in her abdomen, and all of the surgeries except for the first one found nothing but normal tissue in her abdomen. So that made me a little suspicious. I asked her, Elizabeth, is there anything that makes the pain better or worse? Because that's one of the questions you ask to try to see, is it affected by position or what? And she says, yes. And I said, well, what makes it worse? And she says, when I'm around my husband. And then I said, and is there anything that makes it better? And she said, yes. And I said, what is it? She says, whenever I'm not around my husband. And so I said to him, would you mind stepping out of the examination room for just a few moments so I can complete my history and physical? And so he stepped out, As soon as the door closed, she said, "Oh, I'm feeling so much better now. Maybe I don't need surgery today." And so then I presented it to Dr. Barbour. He was the attending physician. You know, the medical student works up the patient and then presents the findings to the attending who confirms and whatever you think is going on. And he concluded, as I did, that there was a real difficulty between the two of them in their marital relationship. And she was probably feeling a lot of anger and a lot of hurt and a lot of disappointment. And also, I learned that she was working in a fishery in Alaska. Her husband owned, putting sardines in cans on a kind of production line for 8, 10, 12 hours a day. And it was very clear that they didn't have a happy marriage. And we referred them to an expert who could evaluate the situation and see, is she safe? Is there a chance to save this relationship? Do they need to split up? And I have no idea what the eventual outcome was, but it was really a powerful experience for me to learn the power of our feelings and our emotions to cause not only depression and anxiety and loneliness and anger, but also intense physical symptoms that can fool even doctors into thinking someone needs surgery. And one of Dr. Barbour's real themes was people get trapped in the medical model, and doctors are only trained to think about symptoms and diagnoses and prescriptions to give to people. And he said, of the people who come to medical doctors, at least a third of them do not have medical problems. They have human problems. And that was the message that he lived for and was trying to share with doctors. And a lot of the doctors thought that was cool and learned to use it in their practices, and others weren't comfortable. They want to continue ordering X-rays and that type of thing. But the take-home message is that if you or a friend or a loved one struggles with aches and pains and keeps going to doctors and they can't find out anything that's wrong with you, the odds are very high that you have a human problem rather than a medical problem. And think about that. That's what we ask patients to do, to focus their energy. Maybe they have empty nest syndrome. The kids went off to college, and then the woman became depressed and developed physical symptoms. And what she really needed, she was to find new meaning in her life. This was another patient, and didn't need any medical treatment for the problem. And what we saw in that clinic and what he reported on in his book, Caring for Patients, was that 50% roughly of the patients coming to that clinic recovered just by shifting their focus to dealing with the human problems in their lives. The other 50% seemed almost delusional or determined to find a medical solution and a medical diagnosis. So it wasn't a perfect cure for all the patients, but it was life changing for about 50% of them. And it was always fascinating the time I spent in Dr. Barbour's clinic, and I'll never forget him. He eventually became a kind of a mentor for the whole medical center, and then died. And sadly, he died just 1 month after his book, Caring for Patients, was released. It was published by Stanford University Press about this very theme. So if you're a medical doctor, or if you're curious, you might want to read that book. It's a great read. And but I loved Dr. Barbour, and I learned a great deal from him. So if you're struggling with depression, anxiety, and anger, and your life is going to be very different from hers, and it may not be, those emotions may not be due to some, hidden relationship problem, But if you check out the links, either here or here, or wherever they are, you might want to check out our Feeling Great app, because it has AI in it now that's trained to do exactly what I do when I'm with patients. And you can learn to change the way you think and feel. So I love you all and appreciate your tuning in, and see you again soon.